All right, so since I'm recording, just to recap, we're going to talk about VA, CHAMP, TRICARE, employer, union, and tribal coverage. We're going to cover those six things. Okay. Um, Extremely important, again, that you understand how these work because some of them can have deep impacts if you put them on a Medicare Advantage plan. There is typically, of course, well, there is no such thing as two primary coverages, right? Certain coverages, if you enroll into a Medicare Advantage plan, they'll just lose altogether. Some coverages, if you enroll them into a Medicare Advantage plan, they work together. Okay, so essentially, we're going to start with veteran coverage. It's the easiest and simplest. So when I say VA coverage, we're talking about strictly just VA coverage, right? Not TRICARE and not CHAMP. They just have veterans benefits. Okay. Um, there's two different kinds, typically, of veteran benefits that you're going to see. One is going to be 100%, and then you have everything else. So with veterans benefits, if they're not 100% disabled, pretty much, then they usually don't have dental coverage. Okay. Well, how is that useful to you? Well, it's useful to you because if they don't have dental coverage with VA, this is a really big selling point with Medicare Advantage, right? So that would give you another avenue, another selling point to try to convince them to take a Medicare Advantage plan. Because if they have VA coverage, they're probably not seeing civilian doctors, right? They're getting their medicines from the VA. They get their vision and the hearing. Everybody gets VA vision and hearing. So those are the only things that's useful to you would be dental and a give back. So for example, and I'll screen share this just so you can see what I'm doing. If I was working with someone that had, regular veterans coverage, and you can just ask them, you don't have to guess, hey, do you get dental with the VA? They're going to know. Okay. I don't think I've ever had someone not know. Okay. They pay very close attention to their VA benefits. Okay. A lot of them are unhappy with the VA. Some of them won't use the VA. Um, so we're going to talk about these different scenarios. So if we look at this plan here, it has the highest give back, right? It's $160 a month. That's a lot of money. Okay. So I would probably start here if I was going to present them a plan. If I go down and look at the dental coverage, you can see that it's got coverage on preventative dental pretty much and fillings. So preventative dental and fillings. So cleanings, oral exams, x-rays, and fillings up to $1,000 per year. Right? So that's kind of a selling point that you can use. What if they wanted dentures? Well, they probably wouldn't want this plan. So then we'll go down to the next one, which would be $100 a month. This one has $5,000 in dental, which is kind of a crazy amount. Um, but does it cover denture? Yes, it does. So if you look right here, $0 copay for complete dentures, which is right here, and partials. Partials is if they only need a top or a bottom. Okay. Bridges are if they need just a couple teeth, right? That would be bridges and crowns. So if they need a whole denture for the top or bottom, if they need a complete denture, top and bottom, or they need just bridges and crowns for just certain teeth, it covers all of that. Up to $5,000 per year. So this is more than enough to get dentures complete. You can get top of the line really nice removable dentures for $5,000. Um, for way less than $5,000, you can do that. So this would be the one I would recommend right here, because they would get $100 a month for being a member, and they would get their dentures paid for in full. Every dollar of it would get paid. And it's a PPO, so if you notice, they can go to any dentist they want, in or out of network. No copay up to $5,000, in and out of network. So that's the great thing about this Humana plan, is they can go to any dentist they want, right? Again, huge selling point. This Humana plan would be easy to sell, especially Jared. This is in our area, so this is something for you to keep in mind, is that this plan's available. Obviously, you don't have Humana due to the blackout, but I can always submit it for you. If you also notice, in our area, there's only two carriers that have veteran plans, which is Humana and United Healthcare. So for veterans specifically, in our area, I will probably have to do those. Okay. However, again, that would be my thought process of choosing between these two plans for someone that does not have 100% VA and does not have dental. If they did have dental, then this would be an easy choice. You would just simply put them in the highest give back plan. Now, if they don't go to the VA for doctors, if they do go to civilian doctors, then you have to be at least a little bit more considerate of what you do when it comes to medical cost, right? So if we look at this plan here, if we go back into it, the medical isn't exactly cheap, right? It's got a $500 per day hospital copay for 4 days. That's $2,000 in hospital copay. It's got a $9,000 medical max, right? Specialist is $45. Okay. The medical cost on this plan for diagnostics, for example, is pretty high, right? Up to $280 for certain advanced imaging. So it's not exactly cheap to use for medical, but it's a veteran plan, right? Most veterans are not going to use this for medical. But if they did, then we would usually want to start with whatever plan, using the same thought process I outlined when we talked about how to pick a plan in a previous training. Look at medical max out of pocket and specialist copay. See whichever ones are less, which in this example would be this top plan, and start there, right? $4,000 medical max out of pocket sounds a whole lot better than $9,000, right? Less than half. The hospital copay is also lower. Specialist copay is lower. And if we look down here at the advanced imaging, it's quite a bit lower, right? I wouldn't worry too much about this copay here. Outpatient hospital advanced imaging. A lot of times they're going to do it at a radiological center or a doctor's office, not a hospital. You can even let them know, hey, if you do like an MRI or CT or something, don't go to a hospital. Have them send you to a radiology facility, right? Because it's cheaper. But if we compare those costs again back to this higher give back plan for radiology, you can see it's about $100 less, right? 280 to 180, 335 to or 200 to 180, 200 down to 180. So it's lower, right? On top of the specialist, hospital, medical max out of pocket all being lower as well. Also, if you notice, this plan has more dental. It's also going to have more vision coverage. Most likely. If I go back and look at the other one, it probably has less vision. This one has up to $250 for glasses. Okay. When would you offer this over the higher give back plan? You can see this is $75 a month and this is $160, so it's $95 a month less in money. I would offer this when they are going to use civilian doctors, right? They know they're going to use civilian doctors. They don't want to go to the VA, or they tell you, I go to the VA, but also I go to civilian doctors. And they're not telling you, oh, I've seen all these commercials, I want as much money as possible, right? if they're not proactively pushing for money, then I would start with medical. Because here's the thing. If you put them on this plan down here and they get their first radiology bill and it's $300, first thing they're going to do is call you, complain about it, and then possibly disenroll. Or they're going to tell you, can you just put me in a plan that has lower medical costs? I can't afford this every time. Even if the plan's giving them the money to pay for it, right? People have a scarcity mindset. So when they see a big bill, first thing they're going to think of is, how do I not get this again? And the easiest course of action to avoid that is to change their plan, right? Then, of course, you could try to, well, you're getting $160 a month, which helps pay for that, right? If you change your plan, you're going to get a lot less, blah, blah, blah. But if you just put them in a cheaper medical plan with money, right, they're still getting money, they're probably going to keep it longer and be much happier with it when they do use it for medical, because it's a much more reasonable cost. So you just have to weigh it, talk to the person, see what they're telling you, and plan accordingly. Okay. Another thing we're going to talk about is CHAMP VA, which is for family members of veterans, right? The veteran themselves does not have CHAMP VA. Okay, CHAMP VA is for veteran family members, spouses, like, for example, right? When you're talking to people on Medicare, they're almost always, of course, going to be someone's spouse, right? Their husband or their wife is a veteran. Okay, I work with CHAMP VA all the time. I've worked with hundreds of people with CHAMP VA and put them in plans. When you do CHAMP VA, same thought process. Okay, we are going to usually look at the most affordable veteran plan with money if they get medicine through CHAMP. Okay, if for any reason they tell you that they're not getting any kind of medication coverage from CHAMP VA and they're like certain about it, then you can't do a veteran plan. You would have to do the best, regular MAPD plan that you can find them. Like, for example, maybe this Humana Give Back plan right here. They still get money, but it has medicine coverage. But typically for people on CHAMP VA, you can do a veteran plan for them. Then you have, we'll come back to CHAMP in a second. I want to quickly note TRICARE. Some people don't even know what TRICARE is. TRICARE is for people that served at least 20 years in the military. Okay, so people who didn't serve such a significant amount of time don't get TRICARE typically. I mean, pretty sure there's other ways to get it other than serving 20 years, but I do believe that service time is the primary way to get access to TRICARE. And I want to mention TRICARE because it works really similarly to CHAMP VA. So here's how these two veteran insurances work. Okay, so let me see if I can use the Paint app to further my example here. Okay, so here is their Medicare plan. Okay, this is the Medicare plan you put them in. Okay, this is number one, meaning that it pays first. Okay, once it's done paying, then you have CHAMP and TRICARE. They pay second. Okay, for civilian doctors, and I'm not again. This is CHAMP and TRICARE. Okay, not regular VA. This is CHAMP and TRICARE. Okay, so what does this mean? Well, for example, if we look at this top plan, there's a $30 specialist copay. Okay, so after their Medicare plan pays, they have a $30 copay. That gets sent to Champ or TRICARE for payment. Okay, so Champ and TRICARE pay second, and they cover, you typically will cover copays, coinsurance, or deductibles left over after Medicare pays. Okay, so that means that things like specialist copays and like inpatient hospital copays, small medical deductibles, things like that, that back end cost can get paid for. Okay, Champ VA. There's a really good some really good websites and stuff like va.gov that have more information on how Champ works with Medicare. There are also only certain services that Champ will pay for. So, for example, you don't want to tell them every medical cost will get covered by Champ that's left over from Medicare. I'm more using specialist copay as an example to show you how that works as far as Medicare pays, they have the $30 specialist copay, then they send it to Champ. If Champ or TRICARE doesn't pay for this $30 specialist copay, then it gets sent to the member. Okay? But things that Champ does cover are things like inpatient hospital, hospice, family planning, mental health care, outpatient care and procedures, which is like office visits. So that $30 specialist copay would fall under that. It's like primary care specialist visits, things like surgeries, outpatient hospital visits, skilled nursing care, ambulance services, medical equipment, organ transplants, and prescription medications. Okay. Champ does not cover dental and vision for free. They have something called VA DIP, which offers them dental insurance for a premium. Okay. Um, the only things that require pre-approval from Champ are inpatient mental health, alcohol and substance abuse treatment, dental care, and organ transplants. That's it. Hospital, doctor's visits, medications, all that stuff, they don't need prior approval from Champ. Once that cost gets submitted to Champ, um, they pay the rest of it. Okay. Something else that it's really important to note is that their civilian doctors have to be in network if it's an HMO. If it is a PPO, typically you're fine. So, like for example, on this plan, if you notice, the in and out of network copay for most services is the same. Um, well, for some services, it's the same. Things like primary care, hospital, specialist, it's not the same. You would want to try to put them in a plan where their doctors are in network to get the lowest cost. But if not, um, they would just have to submit the rest of the bill to Champ or TRICARE. If they give their doctor's offices the so whenever they have this plan, you should basically tell them, you should explain this to them, right? Medicare, like for example, Humana is going to pay first. Everything else will get submitted to Champ or TRICARE. So you should let them know when you go to your doctor's office or when you go anywhere, you have to give them your Humana card and your Champ or TRICARE card. Okay? Um, and it's also important that you let them know to bill your Medicare first and then bill your Champ or TRICARE second. If they try to bill Champ or TRICARE first and then Medicare, they won't pay. They have to bill Medicare first and then Champ or TRICARE. Okay. Um, Now, for TRICARE specifically, TRICARE does cover a lot more things than CHAMP, and they're a lot better at paying the cost that's left over after the Medicare plan. But again, TRICARE is also for family members. You can have TRICARE and not be the veteran. I've worked with a lot of people that are not veterans themselves and have TRICARE through their family members. So not all the time do family members have CHAMP. CHAMP is more for original VA coverage, regular VA coverage, spouses and family members, right? TRICARE has their own spousal coverage, okay? Family coverage, I guess you could call it. But they work really similarly as far as CHAMP and TRICARE. Um, and then, yeah, so that's kind of how it works. Medicare first, again, with my diagram here. It goes to Medicare first. This is what's left over. Then it goes to CHAMP and TRICARE for payment. If there's anything left over, then it goes to the member. Cost goes to the member. Okay? Does everybody understand how that works? It's pretty straightforward. I would like a clear yes or no in the chat, please. Everyone understands how this works, just to make sure. Because if you don't make that explanation to them, oh, right, you can see the diagram. Hold on. I was just sharing the right screen. See, why didn't somebody say something? I'm going to quiz you guys. Make sure you're paying attention. Let's go back to my diagram. So, I'll have to remake it. So, here is Medicare. Okay, we're going to call it M. Okay, they pay first. Okay, if there's a copay left over, I know you're muted, there's a chat. They have this cost left over, right? This is their copay. Then it goes down to the VA plan, right? CHAMP or TRICARE, okay, which is second. And then if they don't pay or don't pay all of it, then it goes to the member, which is third. So it always goes like this. This is the order for CHAMP and TRICARE. Medicare, whatever cost is left over goes to CHAMP and TRICARE. Whatever cost is left over after CHAMP and TRICARE pays goes to the member. But typically, they end up paying nothing. For a majority of services, the member doesn't end up paying anything at all. So this is the circle of Medicare and VA coverage life right here. Medicare, CHAMP, TRICARE member, right? It is really easy how VA coverage works with Medicare. It's super duper easy. Okay, then we're gonna talk about retirement coverage. Okay, you're gonna need a lot of people that have retirement coverage, union coverage, federal and state retirement. They don't work together. Okay, Medicare Advantage plans do not work with these coverages. So if they have any kind of retirement, wow, that is an ugly R. If they have any kind of retirement, this is their retirement right here. They have to choose between Medicare Advantage and their retirement. Okay? So this is the member here. They have to make a decision. Okay? They're always going to go with the retirement first. Always. They're going to take their retirement first. Whatever's offered, they're going to take. Okay? So you may think, well, why would someone choose to take a Medicare Advantage plan? Why would someone do that? Okay? There's a couple of reasons. And I've had to change people off retirement plans. These are the reasons I've heard. One is that the retirement plan no longer covers their doctors. I'm just going to put PCP, for example. They stop covering their doctors. They go out of network. And they have to have these doctors Sometimes the doctors are more important to these people than the insurance is. Okay, so sometimes it's doctors. So then they will go down to a Medicare Advantage plan to get their doctors covered. Okay, sometimes it is the premium. The premium on the retirement plan gets too expensive. I've talked to people whose premium on retirement plan, one of them was $1,100 a month. He was paying $1,100 a month. It was like 50% of his retirement pension. His income was going to his insurance plan. Right? That was insane. He was only getting like $2,000 a month, and 1,100 of it was going to his insurance, his retirement plan. Okay, sometimes they can't afford their retirement insurance. Okay, sometimes they're just bad. Sometimes retirement plans are awful. Sometimes the copays are insane. Some of them don't cover certain things. Some of them don't cover medications. I've looked at some retirement plans where the copays were 2 or 3 times more than a Medicare Advantage plan, and it had a $200 or $300 a month premium. And I put them on a Medicare Advantage plan that was cheaper and didn't even have a premium. Right? Now, there's also something in the middle right here, which is their pension. Okay? Sometimes these two things are linked together. You're getting ahead of yourself, Jared. We're getting there, buddy. So, and I do mean sometimes, this is not always the case, but sometimes their retirement insurance and their pension are linked together, meaning that if they do leave their retirement plan, they do lose their pension. Okay? But not always. Sometimes they can keep their pension and take a Medicare Advantage plan. It's 50-50. I've worked with plenty of people on retirement coverage that they get the confirmation from their retirement that if they leave the plan, they keep their income. Okay, but not always. So here's what you should do. When you're talking to someone on retirement coverage and they're expressing their desire to leave the coverage, do not enroll them into a plan on your first call. Okay, what you should do is you should let them know, hey, call your benefit administrator for your retirement insurance and ask them, if you drop this plan, will you lose your pension? If they tell you no, here's my number, call me back, and I will put you in a plan that you're going to be way happier with. Okay? If not, and you're going to lose your pension, you have to stay where you're at, even if you don't want to. That's what you have to tell them. Even if they don't want it, there's nothing they can do. They're not going to lose their pension to go with your insurance. Promise you, 100% of the time, they're going to keep their pension, even if they hate their insurance. Or even if their insurance is 80% of their pension, they're still going to lose that other 20%. Right? It's never that much. Right? It's usually $150 to $300 a month for their retirement insurance. I don't think I've ever seen one that was free. They always have a premium. So just keep that in mind. You have to think about their pension right here. Have to think about it. And make sure that they understand that there's a discrepancy here between sometimes them losing their pension and sometimes they can keep it, and they need to talk to their benefit administrator. They need to talk to their retirement, basically. The company they retired from, or the state, city, whoever they came from, they need to talk to their benefit office and get the answer to that question. Here's the thing. If you don't do this and you just change their plan, you switch them from retirement to an MA, Medicare Advantage plan, and then they lose their pension, what do you think is going to happen? Jared, what do you think is going to happen? I'm just curious. If you made them lose their pension, what will they do? I'll unmute you. Hold on. Go ahead. I'm curious what your answer is. What do you think was going to happen?
I was going to ask to be unmuted. Um, So mostly if you don't do that, you could face penalties because they could file a complaint. They can also like get your license revoked. But at the same time, there is a lot of setbacks and there's a lot of chargebacks that you can encounter with it.
True. So, yeah, first thing they're going to do, they're going to call 1-800-Medicare. They're going to file a CMS complaint. It's going to go to the carrier. The carrier is going to ask for the recording of the call. They're going to hear you not tell them or explain to them that possibility or to talk with their benefit administrator. And then you're going to have a founded complaint. Probably wouldn't lose your license on that one. Probably not. You probably wouldn't lose your carrier appointment either, but it's possible. You also open yourself for a E&O claim, errors and omissions claim, which our E&O will not cover you for. So then you risk being sued. Okay. Um, and yeah, like Regina said, they're with the little emoji, they're going to be very bad. They will push their complaint to the end of the universe to try to make sure that you get it stick to you because you deserve it, right? You just made them lose their whole pension. Here's another thing with retirement plans. When they leave them, 95% of the time they can never get it back. There is no going back. If they leave it, it is gone. They cannot go back to it. Even if they absolutely hate their Medicare plan, they cannot go back to it 95% of the time. It's also important that you let them know that. If you leave your retirement plan, you cannot go back, even if they want to. In certain exceptional circumstances, they might, but a majority of the time, once you drop retirement medical insurance, you do not get it back. Okay? So just keep that in mind. When they leave their retirement insurance, they are consciously making a decision that they're willing to lose it, period, for good. Okay? So if I'm talking to a member that's leaving retirement, I believe three things I'm gonna say on every call. One, do you understand that if you haven't talked to your benefit administrator and gotten confirmation that you'll keep your pension, you may lose your pension by doing this? It's important you talk to them. Two is you also understand that if you leave your retirement insurance, that you may never be able to get it back. Even if you dislike your Medicare Advantage plan, I could change it to another Medicare Advantage plan, but most likely you would not be able to go back to your retirement. Okay, I believe those are the only two things that you have to say to cover yourself. This just covers if they go complain after that and they lose their pension, it doesn't matter. You're not going to get in trouble for it. As long as you let them know that it's a possibility and that they understand what they're doing, nothing they can do. It will be unfounded if they complain. Nothing will happen. You'll be fine. So it's just important you say those things. Or don't work with retirement at all. Send it to me or someone else. Just tell them you can't work with them or send it to me. If you don't feel comfortable working with retirement coverage because you do run the risk of um, ruining their life and their retirement by causing them to lose their pension if you do it wrong, um, then don't. Okay? You don't have to. It's not like this is going to be something you're doing all the time. Maybe a couple people a year I get that switch from retirement to a regular Medicare Advantage plan. Maybe a couple people a year. And I talk to a lot of people every day. I'm talking to 10 to 15 Medicare beneficiaries a day, at least right now. So just keep that in mind. It's really not that common. It's not something you're doing all the time. It's not something you have to do at all. Okay, you don't have to do it at all. So yeah, this is honestly, this isn't even a overview or anything like that. I think I've really covered everything. So that's how veteran, champ, TRICARE, and all retirement coverages work with Medicare. VA works just fine. Retirement does not work with Medicare whatsoever. Medicare Advantage, I should say. Let me specify. It does not work with Medicare Advantage whatsoever. A lot of them will still have Medicare Part B, but their retirement is the primary payer. So, does anyone have any questions about how veterans or retirement coverages work with Medicare?
Now, when you say work with Medicare, you're talking about just original Medicare, right? You're not talking about adding on Advantage plans in these situations.
Now, I'm specifying specifically Advantage plan in these situations. Work with Medicare means coordination of benefits. One pays and then the other pays. That's what I'm referring to. Coordination of benefits.
Okay.
Yeah,
So, and the disconnect with me, I guess, is in the past, I was taught you don't put people with CHIM VA or TRICARE on Advantage plans. So
yeah. That's just not
basically,
accurate.
okay. So
There's a
we
lot of
just need
places
to
that do
let
that.
them, okay. So we just need to let them know how it will coordinate with their CHIP and TRICARE
Exactly.
prior to enrolling.
Exactly. That's all. A
All
lot of
right.
places don't want you to touch this because one, they don't train you on how they work together. Sometimes they don't have someone there that knows enough about Medicare to train people on how to do it correctly. So a
Mhm.
lot of places don't want their agents to touch it. There's risk involved. It's liability for them. Um, and when you're working with hundreds of agents, right, you can't really make sure they're all doing everything correctly. So I have also been at places that did not want you to work with people that had TRICARE or CHAMP, but only because, and I've had this conversation with all of them, only because they either didn't know necessarily how it worked themselves or they just didn't trust their agents to do it the correct way. So I hope I can trust you guys to do it the correct way, especially given that we will have a permanent training available for this for going back to it. But just keep in mind, if you work with someone with retirement, you're taking risk. If you work with someone with VA, there's not really a risk. Um, the only harm you could do is cause issues with their providers. If you put them in a plan their doctors don't accept, their civilian doctors, then obviously that's going to be a problem, right? They're not going to be able to go there. That's the most harm you can cause. You really can't do any damage to people on veterans coverage, even if you put them in the worst Medicare Advantage plan in the world. Like, it doesn't really matter. If their doctors accept it, they're going to have that coordination of benefits, and then they're going to get free extra benefits anyways. Like, you really can't hurt nobody on VA. I want you guys to work with veterans. I am planning on giving veteran specific leads for people who have been identified as veterans, just just to try to push givebacks and then the extra benefits. But if any of you don't want to work with veterans, if you don't feel like you have a good understanding of it, all you have to do is tell me, and I just won't give them to you. But it doesn't mean that some of the people you call won't be veterans. I can't really control if they're veterans or not when I'm giving you guys, just like people turning 65. They may be veterans, they may not. So hopefully that answers your question as far as why other places would tell you that they don't want you to work with veterans, but I'm okay with it. Any other questions? Oh, Jared said he's good. Orlando, do you have any? No
I'm good.
questions?
Thanks.
Say again?
I said I'm good here. I
Okay.
got it.
Orlando, any questions from you? No
No,
questions?
you took care of it when I was
Very good.
trying to let you know I couldn't see the diagram.
Oh,
So
yeah, that's
now I'm
okay.
fine.
I didn't see your hand up. I had the diagram over the screen. But yeah, that's okay. Just
Yes, sir.
for
I'm
future
fine.
reference, just put it in the chat if you can't see anything. Um,
I did. It's in the chat.
well, I seen it once you put it in the chat. I did see it, but I meant anyone else just for future reference. If there's something missing, just let me know in the chat, please. Um,
Don't make me laugh. Okay.